I'm hepatitis B positive, but anytime I visit the hospital with my various labs, my doctor tells me I do not need antiviral treatment. This gets me confused. I do not know what to do. You must understand that not everybody who tests positive to the hepatitis B virus would have to be on antiviral treatment, especially. There is a guideline for treating individuals who test positive to the hepatitis B. Now, let's break it down. So, for instance, you've tested positive to the Hep B virus, you do your profile test, and it so happened that the virus is active, your envelope antigen is active. Then WHO recommends that we should look at the viral load. If the viral load is more than 2,000 international units per mil, and persistently your ALT, which is a liver enzyme, it is above normal persistently for about 3 to 6 months, where the upper limit is twice the figure that you are getting from the results, then you qualify as a candidate to be put on antiviral drugs. Then again, you could also have an inactive infection, but if you're, an inactive infection, meaning the envelope antigen is negative, but your viral load is more than 2,000 international units per mil, and you have a normal liver function test results, especially with the ALT, according to WHO, then we probably may not have to start you on antiviral drugs. In that case, if your ALT is above normal, then we may have to rule out other liver conditions or other liver diseases or other occurrences, as the ALT may not only be coming from the liver. We may have to rule out other things, and then we may start you on antiviral drugs. You could also have a negative envelope antigen. Your viral load may be more than 2,000 international units per mil, and if you are above 40 years, WHO recommends that we start you on treatment. And then when you do a fibro scan and it is F1 and above, we may also start you on treatment. And then if there is any evidence of liver cirrhosis, or you may be having severe manifestations of the infection, then we may start you on antiviral drugs. Another thing that you should also have in mind is that you can live with hepatitis B for so many years, but as long as your lab tests are within normal range, your viral load is less than 2,000 international units per mil, and persistently you do not exhibit any signs and symptoms, then what we would do is that every 6 to 12 months, you may have to go back to your doctor, do the various lab tests, and then when there is any changes that you may need to be started on treatment, your doctor will inform you. Several of us have been put on